Dog care signs you might miss. A dog's cough may be more than a cold. With distemper, don't judge one symptom alone. Low energy, poor appetite, watery eye or nose discharge that turns thicker and pus-like in 1 to 2 days, plus coughing or trouble breathing, is a pattern to take seriously. Next, check the paws and movement. In a longer course, paw pads may thicken, harden, or even crack, an important clinical clue. After recovery begins, nerve signs can appear 7 to 21 days later, like seizures, circling, an unsteady gait, or sudden twitching, so check with your vet. Crate battles usually start with pushing. Never force your puppy into the crate. Be patient and let them investigate it on their own, because choosing to approach a new object lowers fear much better than being shoved toward it. Make the crate feel like a private, comfy space. Add blankets, bedding, and a toy. Once your puppy willingly goes in, praise right away, and give the food reward after entry. A food-stuffed toy can also keep the crate feeling fun, not like a place they were trapped in. Sudden fur everywhere? Your dog may be stressed. Dogs can shed when mental pressure spikes. Unlike human hair loss that builds over time, a dog may drop a surprising amount of fur after just a few minutes, or a dozen-plus minutes, of stress. Look at the context. A new class, a busy pet cafe, unfamiliar dogs, or a leash held tight the whole time. Stress activates the sympathetic nerves. The erector pili muscles contract, pores rise and close, and loose dead hair gets pushed out. Give your dog space to settle, use rewards, and keep the leash calmer. Your pet's blood pressure is easy to miss. Around age 9, start taking blood pressure seriously at vet visits. That's when kidney disease, diabetes, and endocrine problems become more likely, and those conditions can push blood pressure up. At the clinic, the number can change with stress. A new room, someone holding the paw, a car ride, or a long walk right before the visit. A cleaner reading comes from letting your dog settle, skipping the first try, taking several readings, averaging them, and keeping the same details recorded: paw used, cuff size, and even who measured it. Treats may not be the problem. First, check threshold. If your dog is already barking hard and over the edge, food is unlikely to land as learning, and reward value is not up to us. Your dog gets the vote. The best treat is the one your dog actually wants in that moment. The order matters. The scary thing appears, then the good thing follows. Flip it, and food can start predicting the scary thing instead. Timing matters too. Make the pairing within 3 seconds, ideally within 1.5. Then keep practice short, often 2 to 3 minutes, or 30 seconds to 1 minute for newer dogs. Before you correct, pause. When your dog gets it wrong, treat that as information. The behavior still isn't clear enough. Your job is to use reinforcement to make the rules easier to understand, not to slide into blame or punishment. Next time training gets frustrating, turn it into curiosity. Ask, what does my dog understand right now? Is this environment too hard? How can I make the next rep clearer? Clarity builds confidence, and it gives your dog a system they can actually follow. That's it for today. Subscribe for a new guide every day.